top 5 supplements for perimenopause and menopause women, or really any woman over 40. I'm Dr. Jen, double-boarded OBGYN and integrative medicine, your hormone and metabolic health expert. So supplementation is something that I do discuss with patients, but really it's meant to supplement, right? And so if you have adequate nutrition and are getting these vitamins and minerals through nutrition, you don't need to supplement. But let's talk about the ones that I typically do suggest that women are on because it's harder to get it through nutrition. So number 1 is fiber. Fiber, you need to be getting 25 to 35 grams a day for good gut health, for good hormone health, for multiple reasons. And that sometimes can be a little hard for women to get. You have to be very focused on getting 25 to 35 grams. In fact, I use the Chronometer app to track how much fiber I take in intake, and I typically get around 10 to 15 grams a day. So I use a fiber supplement. There are a lot of them on the market, but trying to aim for 25 to 35 grams a day is important. Now, one thing I will say with fiber is if you are very low in fiber, don't go straight to 25 grams because you'll get bloating and abdominal pain. You need to slowly move your way up to that goal of 25. 2, omega-3s. Omega-3s are powerful. They help with lowering inflammation. They help with joint pain, brain health, moods. I mean, there's so many amazing benefits of omega-3s. And so if you get it through diet, great. If you can't, then be focusing on a total of 2,000 milligrams or 2 grams a day. You can certainly go up. In fact, women with joint pain will often go closer to 3 grams a day. And if you have mood issues, you can have a higher concentration of EPA than DHA, which is known to help with mood issues, so anxiety and depression. 3, I focus a lot on magnesium. So magnesium is involved in over 300 enzyme reactions in the body. And for perimenopause women, especially, sleep is such a hard thing. It's one of the first signs of perimenopause. And so often women need magnesium glycinate to help them sleep. And so magnesium glycinate, even combined with like lavender, which is what I use, can often be very useful for calming the brain down, calming the mind down, getting to sleep, staying asleep. Magnesium is actually used for a lot of reactions to make neurotransmitters. So it's important that you're getting adequate magnesium. And a lot of good data recently has shown that 550 milligrams daily of magnesium can help with brain health as well as bone health. So it's important to make sure that we're getting enough magnesium. And number 4, I often will suggest to patients to take B vitamins if they're not getting that through nutrition. So a complex B, so B1, B3, B5, B7, the whole gamut of B vitamins. Making sure you're getting adequate B vitamins will help with your moods, but also with all of your hormones, especially sex hormones. Number 5, so the last one is vitamin D. So if you're vitamin D deficient, which most women are, then vitamin D is important to make sure you get in a supplement form. And you can certainly focus on D3 with K2 for better absorption. I like my vitamin D levels to be optimal between at least over 40, but 60 to 80 is kind of the range I'm going for. So that may require that you take 1,000 IUs a day. It could be 600 IUs. It just depends on what your levels are. So you need to work closely with your doctor to be able to get adequate vitamin D levels. The one thing I would add, and not necessarily a top 5, but something I use personally is collagen. There are many, many different types of collagen. In fact, there are usually products that are specifically for hair, skin, and nails, and then other products that are for bone. I actually take a product that's a combination of both because I think that it does help me overall with my skin health, and I'm trying to improve my muscle mass and my bones because I did have evidence of osteopenia this year. So collagen, while it's not in my top 5, is kind of very close right behind it, and I do often suggest to women to get collagen. And this, again, is always, supplementation is always a matter of whether or not you get it through your diet. If you get these things through your diet, you don't need to supplement necessarily, okay? All right, if you have any questions about that, then send me information in the comments, and don't forget to like and subscribe to this channel. Thanks.